Welcome to the Young Changemakers podcast. I am your host, Megan Diaz, and this is a global Changemakers production. If you would like to know more about the programs and resources available for you, go check global-changemakers.net. Enjoy the show. Hello and welcome to the Young Changemakers podcast. Today, Lela Dolo is joining me and we are going to speak with her about sexual and reproductive health. We will primarily delve into the project named Help a Mother and a Newborn in Liberia. Lela, we are very happy to have you here. Thank you so much for joining us. Could you please share with us a little bit about you, your background, and how is it that you became involved with reproductive health initiatives in Liberia?
Thank you so much for inviting me, Megan. I'm excited to meet Miss Lela Dolo. I'm from Liberia, West Africa, and I'm currently a second year medical student, studying to be a doctor someday, specifically a OBGYN. My passion for women health is huge. So I'm currently running an organization that started off as a project, Help a Mother and Newborn in Liberia. We are now Help a Mother and Newborn initiative. We're registered and we're implementing activities that affect the life of women and youth positively. So my interest of sexual and reproductive health stem from way down the line. My grandmother was a midwife, that is a traditional untrained midwife, and my mother was a nurse, and she was mostly focused on women. So I was staying with my grandmother and she used to do local delivery at home. And I was curious, I was interested. I felt like there were so many challenges that I saw because these women cannot afford to pay for service to the hospital. They used to come to my grandmother to do delivery, and sometimes things will go bad. From that young age, I got to know that women were going through so much, and most of the things they were going through, there are some things that could be changed. So I made it my life duty to be able to make things better if I grow up for women. So it's something that I've been so passionate about. I've been included with from my secondary school days to my undergrad days and up to now. So this is just how I started being involved with women's health.
Thank you so much for sharing. And yeah, it's wonderful to hear that it all started with such a personal perspective because you said it started with your family, how you saw it in your environment, and then you decided to also act on this topic. And it's always wonderful to see and to hear someone that is passionate about what they're doing. So thank you so much for sharing this with us. And I'm also curious about your experience with Global Changemakers because I know, as you just mentioned, that you started this project. But then, how is it that you connected with this network? How is it that you connected with Global Changemakers, and how has your participation with it impacted your work?
I mean, it has been a long, great journey since I encountered Global Changemaker family. So I joined the Global Changemaker family when I applied for the Global Changemaker conference last year. So a friend of mine shared the conference link with me and said, okay, you should take a look at it and see if you can apply it. I tried, I applied, and fortunately for me, I got accepted, and I was in Cape Town last year with amazing change makers. It was a very interesting and life-changing moment in Cape Town. For that 1 week, we had not only physical activities, we have more practical activities. We were able to share our different knowledge. There were so many great people in the room, people from different backgrounds, whether it's health, engineering, and it was so inspiring. The knowledge that I acquired from that conference, the network, have shaped me in a very positive way because yeah, I was managing my project, but I didn't have expertise in project management, but the Global Change Makers shaped me. They were able to they have their course on project management, monitoring, evaluation, fundraising. Even though it was something I was involved with, but I didn't know the practical step. But because of the conference, the learnings, and everything, I was able to make lifelong connections as well. Recently, a colleague of mine that I met at a conference. Her name is Sarah. She's from Ghana. We were able to have our webinar, cross-border webinar with people from Liberia and Ghana. We collaborated speaking about abortion issue, which is a critical issue in Liberia and other West African countries. So that was a great thing because I met her. She's passionate. I'm passionate. We came together. We did something for the good. And also, not forgetting, Global Changemaker I was able to receive a Global Changemaker grant, community impact grant, to advance one of the activity my organization is implementing, that is sexual and reproductive health education for adolescents in school. So that was a great opportunity. We are currently running these activities in 6 schools. Global Changemaker grant will enable us to strengthen these activities in the 6 school and also expand to 4 other schools. This is a great thing. Like, there has been a lot of life-changing experiences and situations since I encountered the global change maker.
Wow, thank you so much for sharing it. Yeah, going from project management and also to be able to expand your work so significantly. Thank you so much for sharing this. It is impressive, and we're definitely going to speak more about all the work that you're doing in the realm of sexual and reproductive health. And let's start with the project Help a Mother and a Newborn. Um, but exactly before we delve into it, we also need to know a little bit about the context that made you act in this regard. You already said that you are connected to it personally from like a family perspective, but also I'm very interested to hear about the context of your country. Could you please share more about the current situation regarding maternal death in Liberia and its impact on communities?
Thank you so much. Firstly, this was one of the key reasons that prompted me that the time was now to start. When I graduated undergrads 2 years ago, and I did my thesis and took courses of maternal and newborn health in a specific community. Like, there are so many things my eye got open to, even though I was seeing it around me, but it wasn't really aligning to me until I did the study, follow up, ask questions, read more about it, and I got to know that Liberia has one of the highest, and is currently the issue, one of the highest maternal death. We're among the top 10 countries in the world with the highest maternal death. The global standard, you should have less than 70 to 140 women dying in every 100,000 live birth. But for Liberia, you have over 700 women dying in every 100,000 live birth. That would say you have like 1,100 women dying in childbirth per year. That is 3 women dying per day. For newborn, it's even more alarming. More than 8,000 newborn babies died in every year. Most of these causes, or most of these reasons why these women died or lost their babies, they are preventable. Most of the causes, that will be maybe the woman don't have money to come to the facility, so she stay at home to do home delivery and follow experience complication. Another one, this young adolescent who is 16 got pregnant and cannot afford, she go to do abortion is not currently legalized in the country, making it hard, so that make more unsafe abortions taking place. Over 30,000 unsafe abortions take place every year, and most of these abortions end up in death. So you have this young girl who's not ready for pregnancy. She get pregnant, she have to take off the baby because abortion is not legalized. she go and take it off the unsafe way, which might lead to her death. There are so many reasons, preventable reasons, why women are dying or women are losing their babies in Liberia. This is one of the reasons Help a Mother and Newborn Initiative was funded. We believe that the time is now, and there are things we can do to help by just educating this young girl about sex education, not waiting for the government to say that, okay, the government will do this, but what can we do as young people to be able to ensure the person is still calling and doing the right step? Not waiting on the government, be able to do something the little we can do by providing SRHR education for these young adolescents, for by educating young women when they're pregnant, why is it important to go to the facility, by using our own resources and expertise to raise funds to make things better for just one person. It's going to contribute to reducing the maternal death. So this is the context of Liberia. It's so sad, but this is the reality.
Thank you so much for sharing. Definitely, these statistics are shocking when you put them into perspective. How is it that the national context compares to the international one? It's even more possible to see how is it that there's definitely an area of action, which is what you are doing, which is the project you have developed. And also, you mentioned something quite important, and is that most of the causes of death, both of children, so the newborns and the mothers, are things that can be prevented. And some of them can be prevented with what you're doing in your project. So, again, thank you so much for providing us with this context. And now I would love to hear precisely much more about your project. So, what is Help a Mother and a Newborn doing? What are its key objectives? And how is it helping to change the trends that define this pattern in Liberia?
Thank you so much. So, for just an overview, Help a Mother and Newborn Initiative, like I said, we started off as a project in 2021 with the goal to at least reduce the many challenges that are faced in reducing maternal and newborn deaths in a specific region, especially a rural community in Liberia. And over the year, we're able to transition from a project to an organization. We have grown and have a lot of gains that I'm going to share. So, what we do is at Help a Mother, we believe that there should be a society where every woman, adolescent, and newborn can receive quality health care, education, and support to thrive and live a healthy and fulfilling life. So, whether that woman is from the urban area or from the rural area, she has the right to receive this care. One thing I left off in my statistic is that data is even more worse in rural places. Women in rural places face more challenges times 10 than women in urban places. So at Help a Mother, we believe that there shouldn't be disparities in care. Whether you are from urban, you are from rural, you should be able to receive the necessary care you deserve. This is why we're on the mission to empower women and their families with essential knowledge, resources, and access to comprehensive healthcare services. Our aim is that we will be able to reduce the maternal and newborn mortality and promote their overall well-being. So we have three ways that we're doing it. One is awareness. We create awareness about sexual and reproductive health issues, pregnancy issues, after pregnancy child care issues. Number two, building capacity. We build the capacity of local health facility staff and the health facility itself to be able to provide the care these women need. And three, advocacy. We advocate for a better healthcare system because there are plenty of things that need to be change based on the system, right? There are plenty of things that we cannot change ourselves. Those things that we cannot change ourselves, we advocate for it. So some of our achievements have been we were working in a whole county in Liberia. Liberia has 15 county. We are working in one county and it's a rural county. So previously that county, when we started working there, that county had a very high maternal death next to the capital city. But based on our work and the work of other organizations in that place, the maternal death reduced by more than 50% from 2021. And that was acknowledged by not only us, that was acknowledged by the UN, the USAID Liberia, because they are also fighting for maternal death. That was acknowledged by the Ministry of Health, and data is available. We'll also see that before, the different facilities or healthcare centers we were working with, less women were going to the place to do delivery, and there were more women staying at home. But because of our interventions, we established big belly clubs or maternal clubs to encourage these women, create a family with them so that they can come to the facility, and we have birth kits. We were raising funds to provide birth kits items for them, which was some of the major things they were not coming to the facility for, because they cannot afford birth kit items. And if you cannot have birth kit items, you cannot go to the facility to give birth. So by having this club, educating them and providing birth kits, there were more facility delivery. There were more people coming to the clinic to give birth, and that was increasing their life. Because if you stay at home, it will cause more harm for you. Also, through our sexual and reproductive health clubs in school, we had students learning about menstruation for the first time. In my country, especially in the workplace, talking about sex and menstruation is like a taboo. Parents don't talk to their children about sex. There is no comprehensive sexuality education in school. Teachers are afraid to talk about sex there. They are not comfortable. But because we are working in these schools to create partnership, make the schools to see reason why we should start having this conversation. We should normalize having sexual health conversation. And the students are now talking about sex. The students are now ambassadors in their community. The students now have ideas about family planning and a lot more. Also, because of fundraiser negotiations with other partners, we were able to get supplies for health facilities. Like I said to you, the health facilities in the workplace, they are so poor. Not because they don't have the staff, that's one of the reasons, but more because they don't have the materials, right? Like basic things like delivery kits, basic things like umbilical cord clamp. Imagine they use um effective thread to tie the navel string of the baby, which leads to the baby death. It will lead to infection. Eventually, the baby will die. So most of these basic things are now at the facility. We were able to provide it to be functional for the next 1 year for the 10 facilities we are working with. In advocacy, we have been really strong on advocacy. That's one thing. Because we know there are a lot of things that we cannot change at the local level, especially to impact the entire country. Number one, the policies that are existing. The policies are so bad. The laws that are existing right now, we're currently advocating that abortion be legalized, abortion be made safe so that women and girls can have access to the service. We are one of the few institutions that are on the front line in advocating for abortion and other policies that
positively affect maternal and newborn health. So there are a lot of things our organization have done, and there are a lot of things that we're currently doing. And I feel so proud. I feel so energetic to continue doing this work because we're not only doing it, but we are seeing the changes, we're seeing the impact, we're seeing the girls that their life are being saved, we're seeing the girls that their education are being preserved, we're seeing women that are being saved from maternal death and their babies, they can have their babies with them. And we're seeing a lot of changes. So that alone is a motivation to continue the work.
Thank you so much for sharing not only about your project, but also all the success that you have had with it. Because you, as you already mentioned, there's been changes even in some statistics as a result of what you have been doing. And I think it is a very comprehensive project because, as you very well explained, it goes from education to advocacy, but you also work with facilities. And I just find it very interesting that you have developed so many different strategies because one of them is precisely the maternal clubs and the sexual and reproductive health clubs. That is so interesting, and that's something that, if you think about it, it's about having the willingness to do it, and you had the willingness to do it and started it. But well, now delving into the challenges and obstacles, because it's not easy. I'm pretty sure this hasn't been an easy road. Yeah, I see you nodding. It hasn't been an easy road, and yeah, I want to know what you have faced as a young change maker. What has been some of the main obstacles and challenges that you have gone through leading a health initiative in your country?
I mean, if I start to list all of the challenges, the obstacles, we will not end this call. So I will try my best to make it as short as possible and just key point and pinpoint the key ones. Number one obstacle is the laws or the health, the government. That's one. And it affects the work we do so bad. For instance, we're educating girls to take family plannings, and family planning should be available at the facility. We say if you in order not to get pregnant, you should go to the facility, you take family planning. But these girls go into the health facility to take family planning. The family planning are not available. You see, if the family planning are not available, they will get reluctant. Maybe they go there this month and they can take the injection, but the next time they come, they don't have the injection. That means our goal of preventing teenage pregnancy will be at a high risk. It will be affected because if this girl don't take family planning now, she will have unprotected sex and eventually get pregnant. Another issue, we tell the mothers, go to the hospital for your antenatal checkup every month because it's important. This mother will walk long distance and come to the facility with a very demotivated facility staff that will not talk to her properly, or with no medication available at the facility. It hinders that work we do. Like the abortion law, this girl get pregnant and she don't want to keep the pregnancy. Now, because the abortion law is very, very strict and it doesn't allow abortion to take place at a safe environment like in the hospital, she will eventually go and do other things that might lead her to maybe might lead to her death. That has affect our goal of reducing maternal death. So you see, the laws, the policies, the government, there are different things that are available. They are actually killing us. This is why we will try our best every time to solve that problem, advocate, because it sometimes affect the impact or the aim of our work that we do. Another one is financial stability. As a young change maker and a young organization, we're not just there with funds. I would say, I would not say, yeah, we're not just there with funds. We haven't reached all of the criteria. Maybe at that time we were not registered. We didn't have financial system in place. Yes, we were passionate about the job, but we were not getting the finances. We're not getting empowered financially to be able to do what we can do. So it limits our impact. It limits where we can reach. Yes, we'll try, we do our small fundraisers because we don't want to give up. We feel like this is something that we should do. We'll do local fundraisers, but it's not enough. So limited financial stability or standing has been a serious challenge for us. And just navigating the entire thing and trying to stay afloat. As a young lady, I'm also in the medical school. I have to study and pass. It's really stressful and time demanding. And then I'm running this NGO that is also time demanding. How to balance and stay afloat and ensure that I am doing my best and stay mentally okay. There are times that I will be so drained, like I really want to give up. And there are so many nights I'll feel like this is too much for me. How can I be able to do this with low motivations all around me? Like the country is not motivating you, you're trying your best, people are not helping, and it's just really, really crazy. The challenges there are so much. And not forgetting the people we work with, our beneficiaries, they also give us a huge challenge. Behavior change is not something that is easier to do. Behavior change. Working with people that believe that this is what should be done all their years. Trying to change their mind is a very hard thing. It has been a very hard thing. Even though we have been persevering, we have been finding ways, but those are some of the things that really give us a hard time. Working with the locals, the health facility staff, they are not taking their pays on time. They're not really passionate as we are, right? And we cannot do this without them, their own ground. Sometimes they store the process of the work we do because when we reach out to them, they have to reach out to these people in the villages. It's a very long process. There is no communication, no phone. They have to find a way and reach to them one by one. And you will not have somebody in a very poor state that haven't taken pay for 2 months being active enough to do that work. So it's just so hard to get everything that we want to do done the way we want it. But we have to, like, again, if there's no challenge, then there will be no success. We have to find our way around these challenges, find innovative means to be able to pull through. And this is why, since 2021, after I'll say 2 years, we're still actively running. We haven't given up yet because we have always found a way.
Definitely many challenges, and I commend you for being still able to continue and do a lot of great things for the sexual and reproductive health of mothers despite these challenges. I think you mentioned, you started your answer saying, well, how to begin. There's a very comprehensive list of challenges, and it's true because it's not easy. So again, I think it's important to recognize that despite those challenges, the project's still ongoing. You mentioned, for example, mental health. That is something that sometimes we forget. It's not easy to be dealing with all of these situations, especially if it is a health initiative. So I can imagine that it can be a lot to take because you know them. You're working with them with your maternal clubs, or you are working with them with other education activities, and then if unfortunately something goes wrong, it can be something very hard to take. And as well, others replies that I've heard with other young people working in social projects is definitely resources. So always resources. It's very hard because I was recently speaking with a Changemaker, and she was telling me that it's very similar to you. She has a lot of passion in what she does, but there is a moment when passion won't be enough to live. So if you only do things with passion, that's amazing, but then there's going to be a moment where you will just need to sustain yourself. You need to have an income to be able to buy food, your health, etc., etc. So especially for young people who are dedicating a lot or even most of their time for social or sustainability initiatives, it's necessary to find a balance between the resources for the project and also for keeping it going and supporting it, because at the end of the day it's work and it takes time and it needs to be recognized and valued. And I would just like to end up with highlighting the fact that attitudes and changing mindsets, it's definitely one of the hardest challenges. But again, I commend you for what you're doing. As you said, speaking about menstruation or about sex is a taboo in some places, and it is very complicated to change that mindset. So I think it's something to keep in mind that it's not easy because you're making a transformation. When we speak about, for example, some responses in terms of gender, we have this terminology that a response or like a project can be gender sensitive and can be gender responsive. That's a higher level. And the highest level is gender transformative, which is exactly what you're doing. Because when something is transformative, it means that a project is it's having such an impact that it can change mindsets, that it can change attitudes, that it can change behaviors. And that is one of the hardest things to do in a social project. It's very straightforward when you, I don't know, if you run a project and you just want to make it gender sensitive or gender responsive, it's even harder. But when you want to make sure that you're changing the way people behave, that is very complicated. And I thank you so much for highlighting that in your reply, because I think it's important to keep in mind that it's not very easy. It's not like tomorrow you're going to wake up and after you got a class, your whole set of values, ideas, and thoughts are going to be different. So again, thank you. And as well for any young person that is listening and that is working on a social project, to know that this is something to bear in mind. It's not going to be simple. But well, and having gone through this list of challenges and having heard more about your project, having heard more about the success that it has had and its objectives, I would like to move on to something a little bit more general, and it is overall the importance of sexual and reproductive health. We have talked about it in a very specific way with your project, but I want to ask you in general, why do you think that sexual and reproductive health and rights are essential in our contemporary world? Why is it that we cannot ignore them and we cannot just think about it as a taboo and not talk about it right now?
Thank you so much. So, the first thing I want to make clear is that sexual and reproductive health is a fundamental human right. Just how we have rights to every other thing, we have rights to have better sexual and reproductive health. And sexual and reproductive health is tied to a lot of different things. If you are not sexually and reproductively active, it affects you in different ways. And if there is no access to sexual and reproductive health services, it affected the society in different ways. We can all see if people are getting pregnant, they are not having sex education, they are not having access to contraceptive. Young girls get pregnant and they born babies that they will not cater for, and they are a burden to the society. It affects the economy. It affects the society. If you have somebody that maybe have some sexual and reproductive health issues, they're never ever going to perform, because it will not only affect their sexual health, it will affect their mental health. So it's really cardinal that people have access to sexual and reproductive health issues, health access and awareness and education and everything is very, very important, because not having it is going to affect us, especially we're in a low income country like Liberia. We already have so many challenges, so many downfall, like low income, low economic workforce. And imagine if you add up sexual and reproductive issues there, where there's no access to family planning, it will just increase the poverty rate, it will just increase the economic stability with us. So that's one thing government and developmental partners should know and keep point, that they will not say, oh, we have to try and find food for people to eat, we have to find job for people to do sexual and reproductive health are not really important. That's how they see it. They see it like, okay, this woman having access to abortion is not important. The woman having access to, this girl having access to sexual and reproductive health education is not really important. Take it from on the table. Now remembering that without these people having access to these things, who will they be able to do the work that they should do? Will they not put more burdens on the society? Will there not be more issues? So these are issues that we should pay keen attention to. Sexual and reproductive health, we shouldn't overlook it. It shouldn't be overlooked. A lot of people, a lot of government officials, especially in my country that have interacted with, especially doing the advocacy, they feel like it's not important. They really take it for granted, and it's very, very important. It plays a serious role. If this girl cannot access family planning, she gets pregnant, her education stop. This boy cannot have access to whatever condom, he get HIV and AIDS, or he become father before his time, and this woman will died. If like maybe in Liberia the women are the one doing the agriculture, if these 100 women, if you having 1,000 women dying per year, it's removing from the workforce, and it'll put more burden on the society. I don't know if I answered the question well, but that is how I see it, and I just wanted to just give those analogies.
Thank you so much. And I think actually I would like to go back to something that you mentioned actually at the beginning of your answer, and it is that sexual and reproductive health and rights are also human rights. It's been already declared by that, by committees of human rights conventions. So, for example, the Committee on Economic, Social, and Cultural Rights and the Committee on the Elimination of Discrimination Against Women, these committees, which support with the implementation and the monitoring of the conventions, they have already indicated that women's right to health includes as well their sexual and reproductive health. So again, it's not something that we are just like saying, it's something that has been already established by important actors, stakeholders, and their respective committees. And well, having said this, I would like to hear about your vision towards the future. So we have already talked about the context. How is it that it's right now? We have also heard about what you're doing to change that context with your project. And I would love to hear what's to come. So how do you envision the future of maternal and reproductive and sexual and reproductive health? How do you envision the future in our world? And also, how do you envision your project growing and transforming into in the future?
Okay, thank you. That's a hard question, and but I know it's possible. Some of the things that I can see is that even though that future that I look for, if it doesn't come while I'm here, I still hoping that that future will come, and I will still continue working to contribute to that future, because there are some things that we'll work towards that will not happen in our time. I'm really hoping to see that Liberia can be like can reduce maternal death to the international standard. It seems quite impossible, but it can be done. To have less than 100 women dying in every 1,000 live birth, I'm really hoping that is something. My ex-president, my past president, Ellen Johnson Sirleaf, said that if your dream doesn't scare you, it's not big enough. This is actually scaring, looking at all of the reality, looking at like all the things that's telling you that this cannot happen. But I'm still thinking that this can happen. For my project, I'm hoping that we're going to expand to go across Liberia and even across Africa, because there are more people that need the service that we offer. There are more people that can learn. There are more people that can benefit from what we do. There are more things we want to do. And that can also only be done through resources. So we are preparing our organization, setting all of the documents straight, setting all of the system to be in a position to apply for bigger grants, because all of the things that I want to happen, if that is not that is not in place, we're just going to dream and it's not going to come to pass. So we're going to be able to get secure fundings that we can be able to expand our work to more than 3 counties across Liberia. Now we're in one. Over the next 5 years, we're hoping to go to up to 5 counties. Now we're reaching out to like 1,000 plus in total. Directly, we want to reach more than 10,000. So these are the things that we hope to achieve, and we hope that our activities will continue to be impactful. Our activities will continue to improve the health of women and adolescents across the places that we'll be working. Hope to learn more, hope to connect more, hope to share knowledge with others, hope to gain knowledge from others, hope to adapt new approaches, hope to like just do everything that we can as young people to see the change that we want to see.
And I would love to keep that last thing that you said in mind, because you said that, as young people, you can do it, right? And also you highlighted that. I love the mention of the phrase, because if your dreams aren't scaring you, then they aren't big enough. And I resonate with that. I think it's a good phrase, because it's not easy, right? We have talked about all the challenges, and it's not easy to make that world that you described to me in the future, that world that you imagine. It's not easy. It's not going to be an easy road. But then, it looks scary, it looks complicated, we're not sure how it's going to be done. But I think, and I again point that out of your personality, it's your passion. I think that is one of the key drivers, that is one of the drivers that has taken you to where you are today, and has made you achieve everything that you have, and as also you said, has made you have an impact, because you also highlighted that as one of the important things that you envision for your project in the future. You envision a project that keeps making an impact. And this is something very important, because it's making, when we say impact, it means that it's making an change in somebody's life. And that can be very hard, but at the same time, it's something that it's worth it, because you're doing it with passion, and you're doing it for a cause that defends human rights. So again, recalling that part that you said about like young people can make it, I would love to hear one last message from you. So what would you share with all the young people that are listening and who aspire to make a positive change in their communities in the realm of sexual and reproductive health? What would you share with them what advice would you give them? What is your message to all of them?
Thank you for the opportunity. So, to every young person out there who really desiring to make change, who's passionate about making change, I want to tell you that you shouldn't hold back. There will be lots of obstacles in your way. There will be lots of things that would like lots of excuse for you not to start. Your friends, your family will say this is so difficult, you cannot make it. But trust your instinct. And I want to tell you young people that there are things that you will start working on that will not happen in your time. This is something I have learned to how we have learned this from this fellowship that I'm part of currently. And we did a story about the Asian people that were building this church. Like they put their all into the church, everybody worked together, but most of them that started the church died before the church was completed. But eventually the church got completed. They didn't see it, but they laid the foundation for it, and the church got completed. Others benefit. So there are things that will seem so impossible that it can never be solved. If you feel like this is something you want to go for it. Even if you're not going to solve it in your lifetime, it shouldn't make you feel bad. Know that you're building a foundation for those that will come. You're making things softer, making things easier. And that alone is something to be grateful for.
Thank you so much, Lela. Again, this has been so inspiring. Thank you so much for sharing about everything that you have done with your project, and as well for sharing a bit of who you are, and this passionate person who is really willing to make a difference. Passion is a characteristic that makes life so much different and makes you run your project in such an impressive way and has led to all the success you have had. So again, thank you, Lela, so much. Unfortunately, we have run out of time. And thank you to everyone who listened to this episode. And please stay tuned. Thanks for listening to the Young Changemakers podcast. The show is produced by Global Changemakers, and it is edited and mixed by me, Megan Diaz. If you're listening on Spotify, make sure to tap the bell icon to get a notification when we publish new episodes. And of course, please visit global-changemakers.net to access our full archive and resources available for you. Thank you.